Today's Challenging Cancer Now webcast. We're coming to you from the Factor Building at UCLA, headquarters for UCLA's Jonsson Comprehensive Cancer Center. And today we're pleased to be joined by Michelle Doose-Peña, Program Coordinator for the Jonsson Comprehensive Cancer Center's Healthy Lives After Cancer program. We'd like to thank everyone in the audience for participating, especially our Lifeline Connection members. And of course, a big thank you to Michelle for finding the time to talk with us about her efforts to help teen and young adult cancer survivors deal with the post-treatment effects of cancer. We'll begin today's webcast with a few questions for Michelle, covering the following topics: some basic data surrounding childhood cancer, how many cases are diagnosed, what are the odds of survival, what are the most significant challenges for teen and young adult survivors, what is the goal of the Healthy Lives After Cancer program, and what are some of the resources that the Healthy Lives program can offer to young survivors. And also, is this teen and young adult population really different from cancer survivors who are diagnosed later in life? We'll conclude by taking questions from all of you, and you may save your questions for the end or type them into the chat window being moderated by my colleague Francesca Roberto, and we'll get to them as time permits. Before we get started, we have a few housekeeping items. Please take a moment to respond to the poll question on your screen that asks you to choose the most pressing concern for young adult cancer survivors from among the options provided. And please disregard any chimes or background noise that might indicate people joining our webcast this morning. If you have trouble hearing us, check to see if your computer speakers are turned on. The audio will be best over those speakers, or you may use the phone to listen to the webcast. All phone lines are muted and will remain muted throughout the webcast. We have no more housekeeping items, so without further ado, let's turn to today's guest, Michelle Doose-Peña. Thank you for joining us.
Thank you.
And Michelle, we'd like you to tell us a little about yourself and what brought you to UCLA's Jonsson Cancer Center and the Healthy Lives After Cancer program.
Well, thank you again for having me here today. I'm the program coordinator for Healthy Lives After Cancer, and I'm a health educator by training. Came to UCLA first, get my master's in public health, graduated in 2008, but I first participated in the minority training program in cancer control research, and that opportunity led me to meet Dr. Jackie Casillas, who's a pediatric oncologist here at UCLA, and I was very interested in survivorship care for the teen and young adult population, and started off as a volunteer, and position opened up to work with Dr. Casillas and also Dr. Patricia Gans to start the Healthy Lives After Cancer program. And it's really an honor to work with this population, having worked with the American Cancer Society, Dream Relief for Life for over the past 10 years, having started a Colleges Against Cancer chapter at my local college. So having been involved with this population for the past 10 years, it's really an honor to now work as a health educator and the program coordinator for the UCLA Healthy Lives After Cancer program.
Well, we're so glad you found your way to us, and you do have terrific mentors in Dr. Casillas and Dr. Gans. So glad to have you here and on their team. Tell me about the goals of the Healthy Lives After Cancer program and also how it gets its funding.
Okay, well, the goals of UCLA's Healthy Lives After Cancer program is to help teen and young adults access information and resources related to survivorship care. Our program is open to all teen and young adult cancer survivors, no matter where they were treated, and it doesn't matter if you were treated in the pediatric setting or the adult setting. So our program is really targeted to those aged 15 to 39, and we are lucky to be funded by the Art Albert and his family, as well as the Kiwanis Club of Santa Monica, as well as the volunteers who have dedicated their time to help our program as well.
Absolutely. Well, all of those are critical to making a program like this go.
Definitely.
We'd love to have you tell us a little bit about some of the statistics that relate to childhood cancer. How many cases and how many survivors?
Okay. Well, each year, 10,400 children under the age of 15 are diagnosed with cancer, as well as 72,000 adolescent young adults, those aged 15 to 39, are also diagnosed with cancer. So even though there's nearly 12 million cancer survivors in the U.S. today, about 500,000 of those are childhood, teen, and young adult cancer survivor. So it's a population that's definitely growing.
And really, that's a significant number.
Yes, definitely.
We did ask our folks in the audience to respond to the poll question with regard to topics that are of greatest concern to teen and young adult survivors. And the group has said that health insurance is the most critical concern that they identified. So if you take that one on first, Michelle, and talk a little bit about health insurance and teen and young adult survivors.
I definitely agree. Health insurance is definitely a big topic. Actually, doing some interviews with some young adult survivors, they mentioned that health insurance was their number one concern. And with healthcare reform, luckily a lot of young adults can stay under their parents' insurance plan until the age of 26. But health insurance is definitely a big concern. We've done a couple health seminars in the community on the topic of health insurance, and we partner with the Cancer Legal Resource Center. There are great community resources that provide information about accessing health insurance, any appeal processes as well, and they're located here in Los Angeles. So I definitely always recommend to any survivor having issues with insurance to contact the Cancer Legal Resource Center, as well as healthcare.gov. With all the new healthcare reform, I know there may be new avenues that survivors can access health insurance. So I always tell young adults that I talk to access healthcare.gov. You can put in what state you live in, what your specific needs are right now, if you're a young adult with a pre-existing condition, and it'll let you know what your healthcare options now with all the healthcare reform going on. So definitely recommend the Cancer Legal Resource Center and healthcare.gov.
Great. Those are terrific resources, and Francesca will type those into the chat window for everybody if you would like to refer to those yourself, if that's a particular interest or concern of yours. And then, interestingly, in our poll, tied with health insurance, our audience is interested in the risks after treatment. So if we could talk a little bit about what those health risks are that teen and young adult survivors should be thinking about or aware of.
Definitely. I know the risk of reoccurrence is something that a lot of young adults have that they worry about, definitely. And that came up also talking to different young adults. Is this risk that the cancer is going to come back, but also other health problems that can come up 5, 10, 20 years out from treatment. We're lucky here at UCLA to have the UCLA Live Strong Survivorship Center of Excellence that I work with Dr. Gans and Dr. Casillas, and they see patients, definitely young adult cancer survivors, and they talk about their risks. And it depends on your treatment and what you received. And based on what you received and what you were exposed to, they can talk about risks that are applicable to you, whether that could be heart problems, infertility, or any of those different health issues that can come up. And so if that's something that survivors want, and it's open to anyone, you don't have to be a UCLA patient, didn't have to be treated here, but you can come to the UCLA Live Strong Survivorship Center and have a tailored assessment, and then create your own survivorship care plan. And that outlines, what kind of care that you need to be receiving to monitor any risk for health problems. And so we're very fortunate here to be one of the Survivorship Center of Excellence here in Los Angeles, here at UCLA.
Sure. Is that survivorship care plan something new? I don't know that I've heard about that before.
It's somewhat recently new. It's a new term that's coming up, and Dr. Patricia Gans has definitely pioneered that field of all survivors having a survivorship care plan to really empower them to talk to their doctor about the care that they need. And having this document that outlines the treatment they received, the tests that they need to keep them healthy is so important. And if you come to the UCLA Live Strong Survivorship Center, you have the opportunity to develop a survivorship care plan and get one tailored to your treatment.
Great, thank you. Let's talk a little bit about some of the other risks. You did mention briefly infertility as one of those other health risks that can be of concern to this population. Could you share a little bit more about that and
Yes.
some of the resources in that arena?
Definitely. At our last health seminar on April 30th, myself as well as Alice from Fertile Action, we partnered together to talk about this topic, about fertility and how do you assess your fertility. Unfortunately, about 30 to 50% of young women don't recall talking to their doctors about their risk for infertility during treatment, and only 25% of young men actually utilize sperm banking. So we know it's definitely an issue that comes up, and it's something of worry to a lot of young adult survivors. So at the seminar, we talked about how do you assess your fertility, and that's something that you can talk to your oncologist or your primary care doctor with to get the right referrals to get the test that you need, but also how to access services in the community, because fertility treatment can be very expensive, whether that be you want to do IVF or adoption or surrogacy. We talked about the resources that are available for cancer survivor, and so I highly recommend checking out Fertile Action, their website, and seeing the resources that are available in the community as well.
Great, thank you. And we'll share that website with our audience. Francesca's taking care of that for us. Terrific. Let's talk a little bit about some of the other health concerns that do come up with young adult survivors, and one of those is physical fitness and nutrition. How do you get back into a program or start one if you've just finished your cancer treatment?
Definitely. That definitely comes up. It's how do you stay healthy now that you're a cancer survivor? We did one of our health seminars last year, and we partnered with the cancer support community. They have a great exercise program here in West LA, where they have like a non-contact boxing program or strength training, and there's definitely great resources in the community. Actually, this summer I'm going to be a volunteer for First Descents, and they're a program that offers free week-long hiking, mountaineering, and kayaking trips just for young adult survivors, so that you can be among your peers who understand what you've been through and how the struggle of trying to be healthy now that you're a cancer survivor. So look forward. On Facebook I'll be posting some pictures and my own experience participating with First Descents this summer, as I'll be participating in the kayaking excursion and meeting other young adult survivors and getting their feedback to pass that on to those here in Los Angeles. But it's definitely a free program that's open to all survivors. So I definitely recommend Cancer Support Community, checking out their boxing classes, their strength training classes, and yoga classes, as well as the First Descents as well.
Great. Well, since you mentioned Facebook, let me give you a chance to give a plug for Healthy Lives After Cancer on Facebook and tell people how they can access everything that you and your colleagues are up to here if they want to join and support what's going on.
Definitely. You can find us on Facebook.com/Healthy Lives After Cancer. We're always posting articles that are relevant to the young adult population, either new research or new resources that's available in the community. If there's a young adult event that's happening, we like to post that. There's different support groups that are in Los Angeles now just for young adult patients and survivors, and the UCLA Sims Man Center just created a new young adult support group. So we have the opportunity that we post this information online so that young adults know that they can find information that's relevant to them and their community. So we're definitely on Facebook, and definitely follow us to get all the new information. And again, that's Facebook.com/Healthy Lives After Cancer. And also on the Jonsson Comprehensive Cancer Center website, we also have a web page where we have a community calendar as well. So if you want to see what's going on in Los Angeles for young adult patients and survivors, we update that as well. So definitely find us on the web as well on Facebook.
Thank you. Now, we talked a little bit earlier about the role of philanthropic support in Healthy Lives After Cancer. If you had additional funding, how would you use it?
Well, really, the support of Art Alpert and Kiwanis Club of Santa Monica has really made the difference. But we definitely would appreciate more funding that would allow us to outreach to the teen and young adult patients and survivors, so that they know that they're not alone. Unfortunately, a lot of young adults feel isolated when they're going through treatment and have a hard time finding the new normal afterwards. So if we're able to outreach more to this population by marketing, getting the information and resources out there, it would make sure that no young adult or teen feel isolated or alone during the cancer experience.
Thank you. Let's talk a little bit about this population of teen and young adult survivors and whether they're really different from other cancer survivors who might be diagnosed at a different point in their lives.
Well, I think definitely for the teen and young adult, there's a lot going on in one's life. You're either graduating from high school or college, finally moving out on your own, new job, or starting a family. It's really that time of independence. And unfortunately, when the cancer diagnosis, it may mean coming back home to live with your parents, being under their rules, or trying to balance that new job that you had that didn't offer health insurance, and now dealing with the cancer diagnosis. So I think in this special time frame, being a teen and young adult, there's a lot of life transitioning happening, and when you throw cancer in the mix, it could be a lot, very overwhelming to deal with as a young adult. So definitely a very unique population and a privilege to work with.
Well, let's end our interview there, and let's jump to some questions from our audience. We certainly want to thank Michelle for being part of today's webcast, and we want to invite questions from our audience, including one that's already come in, so I'm going to jump to that now. We received a question asking, what's the best way to reach young adult survivors?
That's a very good question. We're always trying to market and outreach to survivors. I think we're very fortunate here at UCLA is that I'm able to either go to the Survivorship clinic, and just talk to young adult survivors if they express to their oncologist or at the UCLA Live Strong Survivorship Center that they have some health insurance needs or they want some resources. I'm able to work with Dr. Casillas and Dr. Gans and connect them. So I think the best way is really partnering with either the oncologist or the clinic, the survivorship clinic, to reach this population, because young adults are very mobile. They have a lot going on, and I also think Facebook is a great way of reaching the young adult population as well, because maybe they don't want to join your page, but they can check it out as well without identifying themselves maybe as a cancer survivor. So really to reach this population is, partnering with either the oncologist or survivorship clinic, and also using Facebook or creative marketing tools.
Great. We're continuing to receive questions, and I certainly want to remind other audience members that they are welcome to type their questions into the chat window. The next question we received was, how many teens and young adults participate in the Healthy Lives After Cancer program?
Great. Well, for most of our seminars, so we have about 2 to 3 seminars a year on different topics, and our last one was on fertility, and then one before that was on health insurance. We usually have about 25 survivors that participate for each seminar, and then they usually bring their support system, whether that be their significant other, a parent, a friend with them. So we usually have about 50 people that show up to our seminar, because we want to make sure that survivors can attend as well as their support system. And what's unique about our health seminars that we put on is that it kind of turns into a support group, an opportunity for survivors to connect with other survivors. They get good information, and then they have the opportunity to talk to someone else who's been through a similar experience. So yeah, we definitely have 25 survivors that participate, and then plus their support system. So we have roughly 50 participants at each of our events.
Great. And speaking of support systems, are there other support groups or opportunities in the community that are a good fit for teen and young adult survivors?
Definitely. There's the 3 that I can think of right now. The UCLA Sims Mann Center offers this weekly support group or bi-weekly support group for young adult cancer patients and survivors. There's also the Cancer Support Community. They just launched, actually this week, their young adult support group. And there's also the We Spark I2Y young adult support group in Sherman Oaks. So if you come to our community calendar, I definitely post all those different support group opportunities, so you know what's going on. And there's also one more in Santa Barbara as well. So if you check us out on the Jonsson Comprehensive Cancer Center webpage, under our community calendar, under the tab for Healthy Lives After Cancer, our community calendar, I put up all those different support groups that are available for young adults here in Los Angeles.
Great. Are there resources that people that are outside of Los Angeles can tap into, or if they come to our site, will they find things that are of interest to them too?
Definitely. There's information I think that's relevant for everyone, and there's a lot of community organizations that may be available that offer similar services in your community. I've also been approached by different young adults that said, I have nothing in my community for me. How do I start a similar program? So I talk with them about the process, and if you don't have something in your community, definitely you can contact me and we can talk about ways of starting your own program for young adults in your own community. I think we have a unique opportunity here with the support of the Jonsson Comprehensive Cancer Center that we are meeting this need for young adults, but I know it's something in other communities that they don't have. So I'm definitely willing to talk with anyone who wants to start a similar program in their community.
Great. Well, I know you're a great evangelist for this out there and encouraging others in other parts of the country and other communities to take on some of these kinds of activities and provide a great support network and resources for young adult and teen survivors of cancer. We'll turn to our audience has gone quiet on us. We certainly welcome more questions in the chat window if anyone has additional questions at this point in time. Certainly, I'd like to take the opportunity to thank Michelle for sharing so much great information with us this morning. As I mentioned earlier, we will be providing via email lots of information and links. Many of the resources that Michelle mentioned are information and things that are available online, so those are opportunities for you to be able to follow up on after the fact. We'll also, by the way, be sending a survey to all of you who are participating this morning, and we hope you'll take a few minutes later today to answer the questions. There will be just a few, but we very much welcome your feedback on both our discussion today and also perhaps you have some ideas for future webcast topics, and we'd welcome hearing from you along those lines. I understand that somebody's typing in, so I'm going to give you an opportunity to do that so that we can see what your question is and pass that on to Michelle. I'd also like to ask Michelle if there are any other resources or areas that we didn't have a chance to mention earlier that you think we would want to remind people about that we might not have mentioned earlier.
I think definitely check out our webpage and Facebook page. We list different resources that are available in Los Angeles related to wanting to get physically active or wanting more information to learn about your risk of health problems that come up as a cancer survivor. Definitely check out our webpage. We have a lot of links to different resources for cancer survivors, and also our Facebook page. If there's something new that comes up, we like to get the information out as soon as possible.
Good, thank you. This is a great question that just came from our audience. Question is, who should I contact regarding delayed effects? An oncologist or family doctor?
It's a very good question. Well, it depends. A lot of times, I would say survivorship care planning is a new topic, so if you do contact your family doctor, they might be asking you, what are you talking about? So that's one avenue. Or you can talk to your oncologist. Again, they might be not too sure what is survivorship care planning, but I think asking both your doctors for a referral to a survivorship clinic, and the UCLA Live Strong Survivorship Center does take referrals. So you could ask your family care doctor or your oncologist to get you a referral to a survivorship center like here at UCLA. That would be the best avenue. There's also resources online where you can create your own survivorship care plan, or that can help you talk to your doctor about creating one as well if you can't get a referral to a survivorship clinic. And those are some options that I can post later on Facebook you can create your own survivorship care plan, or at least help you to start the discussion with your doctor who may not be familiar with a survivorship care plan.
Sure, that's great advice, and I hope that is helpful to our audience member who asked the question.
Yes, great question.
We also just received a question about what are the psychological challenges these survivors face?
I think the psychological challenges, being a cancer survivor, is finding the new normal when you're done with treatment. That you might feel a little different from your peers, having gone through cancer, dealing with the, having feelings of worrying about the risk of reoccurrence, or how am I going to keep my health insurance, or how I get my health insurance. And I think there's some great resources in the community to address the psychological needs, either in treatment or after treatment. And again, I would highly recommend the UCLA Sims-Mann Center for Integrative Oncology. They offer support groups or one-on-one counseling. And even if you're not a UCLA patient, there's some resources in the community as well. I know the cancer support community offers both the young adult support group but also free one-on-one counseling. So if there's some issues or just want to talk about how do I get to this new normal of me being a cancer survivor, there's resources in the community to help you so that you don't feel alone, you don't feel isolated as a young adult. And I think just remembering that 72,000 young adults are diagnosed each year. There's 500,000 young adult survivors, that you're not alone. And I think accessing resources that are available in the community is so important.
Right, absolutely, and certainly the Healthy Lives After Cancer program really is dedicated to helping young adult survivors and teen survivors feel like they are not alone.
Yes, and I think coming to our seminars, when whatever topic, is just the new normal, and just meeting young adults as well. So always, join our Facebook page or email us as well, and to when the next seminar will be, and that's a great opportunity to connect with other young adult survivors as well.
Sure, absolutely. And we have someone typing in a question, so I want to give them an opportunity to do that and be able to ask Michelle for her great guidance once again. Michelle, we're really grateful for all of your expertise and enthusiasm for the work that's going on in the Healthy Lives program and being willing to share that with our audience today.
Definitely. And any ideas for our next seminar? If people want a topic that we should cover, we've done health insurance in the past, fertility, nutrition, and exercise. But if anybody wants us to cover those topics again, or a new topic, how do you manage your care now that you're a cancer survivor, we want suggestions so we can put on these events. And we hold our events actually at Santa Monica Public Library, so that it's away from the hospital. You don't have those memories of coming back to the cancer center. That's a great opportunity to let us know what you as young adults want, and we'll put on these seminars. It's for you.
Right. All right, this is a question that just came in, and I'll let you try to take this on, Michelle.
Okay.
And you may have to defer to your MD colleagues, but we'll go ahead. This person says, I catch cold and coughing more often. Any way to improve?
That's a great question. I know a lot of young adults, they worry about their immune system, but that's something that I would definitely bring up to your oncologist or primary care doctor. And a lot of times, they may say that, oh, it's something fine, don't worry about it. But I always recommend going to a survivorship clinic, going to a doctor that understands the health problems that can come up now that you're a cancer survivor, and getting that referral. So it's definitely a great question to ask your oncologist, primary care doctor, or getting a referral to a survivorship clinic to get those questions answered. But it's definitely a question I've heard from young adults before. So definitely ask your doctor, because it depends person to person as well.
That's great advice, and certainly consulting the physicians in your life and folks who may have been part of your treatment regimen before, and be able to give you better guidance and more personal advice in these circumstances.
Definitely.
And we have someone else typing in, so I do want to give them an opportunity to ask their question, and I think that will probably be the last question this morning. We are planning to wrap up at about 11:30, but we wanted to give a nice full session to all of our attendees, and we're really grateful for all the great questions that have come from the audience. And again, Michelle, to you for providing all this information.
Well, thank you.
I also want to take the opportunity as we get ready to close out to remind people that you can access information about the Healthy Lives After Cancer program and all of the great cancer research and work that goes on at UCLA's Jonsson Cancer Center by simply going to cancer.ucla.edu. That's our website, and you are welcome to visit us anytime. You're also welcome to join the Cancer Center's Facebook page, and we are at UCLA Fights Cancer, so please feel free to follow us as well as follow the good work that Michelle and her colleagues do in Healthy Lives After Cancer. This is a great question that just came in. This is talking about when in the dating world, when do you tell your partner about long-term effects of chemotherapy?
That's a great question, and a question that came up at our fertility seminar on April 30th, and we're hoping to have that video up as well, because we did talk about that issue. And we actually had a survivor couple talk about their own experiences of when he told his girlfriend at the time that he was a cancer survivor, and that fertility might be one of those health problems that come up later as because due to treatment. There is no right answer of saying this time, the first, second, is the third date, or when you're engaged that you tell somebody. I think it just comes up naturally in the conversation, whether that be for one survivor, he said that when they talked about wanting a family, that's when he brought up that infertility might be one of those health problems that they may have to deal with because he is a cancer survivor. But I think when you find the right person, they'll love you for who you are, no matter what you've been through. And if they don't get it, they probably weren't the right person in the beginning. But that's a really great question, and there is no right answer out there. I've been looking for it too, so I can let all the survivors know as well. But I will definitely post that video hopefully soon from our fertility seminar, so you can hear from survivors as well how they talked about when he told his girlfriend when I think their second or third date, that he was a cancer survivor, and some of the health problems that could come up. So, great question.
Okay. And we have an additional question regarding the listserv email address. And Francesca, our moderator, is going to go ahead and type that information in. And Michelle, if you want to mention that as well.
Yeah, definitely. We also do a newsletter as well. We like to let survivors know both on Facebook, but also through our newsletter about what's going on in the community or any new resources as well as the next seminar event as well. So you can send us an email at UCLA Survivorship Prog, P-R-O-G, at mednet.ucla.edu. We can add you to our listserv as well. So.
Great. Well, and with that, we'll wrap up this morning. Again, thanking you, Michelle Doose-Peña, with a virtual round of applause for being here this morning, and to our audience as well for the terrific questions and enthusiastic typing into the chat window so that Michelle could respond very directly to the questions that you have. Please remember that all of you will be receiving a survey later on today, and we invite you to take a few minutes to answer the questions, give us feedback, and any suggestions you have for future seminars. We'll also be sending to you the many links and resources that Michelle has mentioned today via email, so keep an eye out for that. And again, if you would like more information in general about the Cancer Center here at UCLA, you are welcome to find us at cancer.ucla.edu or on Facebook at UCLA Fights Cancer. I want to thank all of you out there for joining us in challenging cancer and especially supporting our research efforts. And this will conclude this morning's webcast. Thank you once again, Michelle.
Thank you. And thank you for the great questions out there.